Welcome to Healthcare Forward, where industry leaders, benefit advisors, and healthcare professionals come together and discuss the changing landscape of commercial health plans. Brought to you by Roundstone Insurance, the first group captive for health insurance, where smarter self-funding meets long-term savings. I'm Mike Schroeder, founder and president of Roundstone Insurance. Welcome back to the Roundstone Podcast. I'm Mike Schroeder, your host, and today we're going to be talking to Dr. Ted Barnett, and I'm really excited about today's topic. It's something I've been looking forward to, and it might surprise you. You know, why is a health insurance company speaking with a doctor who specializes in lifestyle medicine? And it's an interesting question. But one thing you all need to realize is we write a lot of big checks, and it's not unusual for us to write $1 million check for a heart attack, or $1 million check for some other disease that possibly could have been prevented. And as you all know, our insurance product returns the savings back to the employers and the employees. So if we can give them a good idea on how to make their folks healthier, we want to do that. So with that, let me introduce Dr. Ted Barnett of the Rochester Lifestyle Medicine Institute. Welcome, doctor.
Thank you very much. It's great to be here.
Thank you. We met, 4 months ago, I think we were talking?
Yeah.
Yeah, I think on full disclosure, I need to let folks know that I went through a program called Jumpstart at the Rochester Institute there and had incredible outcomes and results. I was experiencing some higher blood pressure, and a friend of mine recommended it. And we'll get into the details about Jumpstart and what doctor does with that. But just full disclosure, I'm a fan.
Thank you.
And I'm an alumni, and I do my best to listen to what the doctor says. So before we talk about the Institute, I understand you have a day job.
I have a day job. I am a radiologist. I do diagnostic imaging. And there's a subspecialty of diagnostic imaging called vascular and interventional radiology, which is usually abbreviated as IR, or interventional radiology. You get to work with your hands. You get to do a lot of MacGyvering, which I kind of like to do. You have patients on the table. You're trying to fix an artery. Things aren't exactly going as planned, and so you have all these tools on the wall. You say, hey, hand me that, hand me this, and let's try that. Oh, that works. Those fit. Let's do that. Let's put that stent in. Let's fix the vein with this. So I became really fascinated with that whole process. I like to work with my hands. So I got my original boards in diagnostic imaging. I was a resident at Tufts, and I finished there in 1984. And that's when I got my first boards in lifestyle. That's when I got my first boards in diagnostic imaging. And then there were no boards in interventional radiology at that time. The first boards were given in 1995. So I was already practicing interventional radiology. I kind of studied up for the boards. I took the boards. I passed that. That was fun. So I became board certified in interventional radiology, and that's just been a fascinating, area for me. It is a little bit stressful. You get called at night, so I carried a pager from the time I finished medical school, which was 1980. I carried a pager. Right, pretty much all the time, and I was on call every 3 to 5 nights. Until just before the pandemic, actually, when my radiology group we actually pulled out of the hospital that we were working in,
right?
Because we all were getting kind of old, and so I haven't carried a pager since maybe 2019,
right?
And I've kind of moved into more of women's imaging, which is reading mammograms and doing a lot of breast biopsies. So I like to say that I used to be a red-blooded interventional radiologist, but now I've become a mild-mannered mammographer.
All right.
Yeah, but it is so interesting to think about what we do in interventional radiology, which a lot of it has to do with fixing arteries.
Right.
And opening up these blocked arteries to people's legs. That was kind of where we spent most of our time. So cardiologists do the heart. Interventional radiologists kind of do the rest of the body. Maybe not so much the neck or brain. That's more neuroradiology. But anything kind of below the neck and certainly below the waistline is kind of interventional radiology world. Plus, we would do a lot of kidneys, so a lot of renal artery angioplasties and stents. And when I learned about what Dean Ornish had basically demonstrated in his randomized controlled trial it was published in The Lancet in 1990. that you could actually open up arteries with just lifestyle changes.
Right.
You didn't need to put in a stent or go to surgery. You could just fix it with changes in lifestyle. And, nobody would.
It'd make you obsolete.
Yeah, exactly. I thought, okay. I used to think, well, what really is the role of these physicians in the healthcare system, in the belly of the beast, if we have an alternative treatment that is just as good or maybe better.
Right.
And maybe doctors should be required to spend half their time treating the disease and the other half teaching people how to prevent it.
Right. That'd be neat. Yeah.
Right? It's never going to happen, right? It's kind of like the analogy I used to come up with is it will be like you trained a bunch of Air Force pilots to fly F-16s and go on combat missions. And, they're excited about doing that stuff. And then you say, there's this potential conflict that's going to break out if we don't send some people down there to be diplomats.
Right.
And talk them out of it.
Right.
And then, and you're going to say, I don't want to do that. I want to fly my F-16. And be like me. I want to use my angioplasty balloon. I want to use my stents.
Right. Right.
And I'm really afraid that a lot of medicine ends up that way, where we learn these challenging procedures that are, fun and interesting and exciting in a lot of ways.
And make money.
And yet that's really not the best answer.
Right. Yeah. And so that's in part what motivated you to start the Institute and go down the lifestyle medicine path.
Right.
Yeah.
Now we as our family, we became plant-based. We used the V word, vegan. We became vegan in 1991.
Right.
After reading about Dean Ornish and his work on the randomized control trial, because my wife had been interested in becoming vegetarian for the animals. I was interested in going vegan for the planet, actually. It turns out that you only need about 10% of the resources to support humans on a plant-based diet as opposed to an animal-based diet.
Wow.
So not only is there the generation of far fewer greenhouse gases, which is something we need to deal with in terms of climate change, but also you're using a lot less land. So all this land that's, rainforest and everything that's being cut down to basically turn the planet into an animal factory, which is kind of what we've done.
Right.
That could all be reversed. Now, what would people who own that land do? Well, they could figure that out.
Maybe they'll grow vegetables.
They'll grow vegetables, exactly.
Right. Yeah.
But so I was interested for the environment. My wife was interested for the animals. So I said, well, all this has to be is safer than the diet we're already on.
Right.
So I said, and so I looked into it and I'm thinking, wow, it's not just as safe, it's a lot safer. I mean, I set the bar pretty low.
Right.
And it turns out that it's the best decision we ever made. We raised our 3 kids that way. They're all still on the plant-based path and doing really well. My son, by the way, who's now 32, has maybe the lowest LDL of anyone I know.
Wow.
So he called me when he was 26 and he said, Dad, my doctors are worried about me. I said, what is it? He goes, it's my cholesterol. I said, your cholesterol? How could that be a problem with your cholesterol? You're vegan. And he said, well, it's really my LDL. I said, well, what is it? He goes, it's 15.
Wow.
So really? Is that okay? Is that okay? I said, well, you're the healthiest person I know. And you're the only person I know who's been vegan since before birth.
Right.
And so I think we'll give you a pass. It's okay.
That's great. 15. I don't think I've ever heard that number.
But I'm just so excited to be able to talk to people about lifestyle medicine and how so many of the illnesses that we deal with are basically optional.
Yeah.
Yeah.
Yeah. That's what's it's exciting.
Mm-hmm.
And also shocking,
right?
That we find ourselves where we are today.
Yeah.
Let's chat a little bit about sick care.
Okay.
And the idea in today's medical world, we react,
right,
instead of avoid or prevent.
Mm-hmm.
So share what is sick care. How do you view that?
Well, so you're the expert on that with dealing with insurance, but of course, the whole healthcare system is set up now to be reactive, as you said, and to deal with mostly chronic illness. I mean, I actually have been telling people for years that 86% of healthcare costs are basically optional because they're self-induced chronic illnesses like diabetes, heart disease, stroke, all these things. And so in preparation for this interview, last week I started talking to ChatGPT. I said, how much of healthcare costs is due to chronic disease? And ChatGPT said 90%. So 86% is about what I've been saying. It's a little higher than that. And of course, ChatGPT's sources were CDC, and they had a few other sources. So they confirmed that. But if you told people that you could save 5% on health insurance or healthcare costs, they'd say, oh, we should do something like that. Mm-hmm. But if I told you you could save 90%, right? If you did the right things. You'd say, what are you smoking, right? So, and it really is true. So much of what we deal with in our culture are these illnesses that are completely optional. And a lot of it has to do with, being overweight, consuming all the junk food, and then that people have been consuming for decades now, and being inactive, sitting around on the couch, and not getting outside. So many of these things that are pretty obvious that your grandmother would have said, go outside and run around and eat more fruits and vegetables. Right? Pretty obvious. But there's no money in that. Right? There's no money in keeping people healthy because first of all, if I give you some advice and you follow it and you don't get sick, you're not necessarily going to pay me for that or even attribute that to me. Right. So that's.
Well, and I think that's maybe where we can bring a different perspective because for an employer who is paying millions of dollars for the health care of their employees, there is money in having a healthier workforce. And there is money in sharing ideas that, heart attacks or heart disease or diabetes, it is avoidable.
Yeah.
And I guess that's a question I have. Like, I think a lot of people just think it's going to happen. As I age, once I get past 60, I'm going to have heart disease. I'm going to have blood sugar issues. I mean, is that true? Is it avoidable?
It's completely avoidable. So now basically when somebody starts to have insulin resistance and pre-diabetes and then diabetes, they go to the doctor. And basically the doctor says, well, I'm going to put you on an oral medication, usually metformin. But basically you're looking down this long, dark tunnel. And it's just going to keep getting worse and worse. It's going to progress. Eventually we'll have to add another oral medication. Eventually you're going to go on insulin. Eventually you're going to get peripheral neuropathy and you're going to have a hard time walking. You might have to have amputations of your feet, toes and feet. You may end up going into renal failure and ending up on dialysis. You may go blind. So all these things are very expensive, but there's also so much unnecessary suffering with that, which should be really the reason why we're talking about this, right? It's the unnecessary suffering. What the doctor doesn't tell you is that there's a little escape door right over here. You can just walk right out. You just change your lifestyle, and that's gonna for most people that's gonna be reversed.
And when you say lifestyle, what do you mean by that? Are we talking about just what we eat, or what does lifestyle mean in your world?
So the American College of Lifestyle Medicine, which, by the way, got started around 2005. And when I joined in 2010, we had 130 members. Now we have 13,000 members. It's just growing like crazy. So that's the American College of Lifestyle Medicine. And they have 6 pillars of lifestyle medicine. And those are, I'm going to get stuck here. Watch this. Let's see if I can. Okay. It's nutrition, which is basically whole food, plant-based diet. It's physical activity, so exercise. It's avoiding toxins, so not smoking or drinking. That's number 3. Getting good sleep, avoiding stress, and nurturing relationships. I got all 6. And we've actually added 3. So our wellness wheel has 3 more. We have getting out into nature, which a lot of people at American College of Lifestyle Medicine are advocating should be the 7th pillar. Getting outside and getting into nature, finding purpose, and finding joy. And you add those things up and, it's having a good life.
That sounds a lot better than taking a bunch of medicine and going down that dark tunnel. To maybe have a lifestyle that's rewarding. We were talking before we went on air here about blue zones. Is that kind of what those communities are doing, following those lifestyle focus?
Sure. So Dan Buettner was working for National Geographic a few decades ago. And his mission was to investigate the so-called blue zones. And they were first identified by some demographers looking at health outcomes around the world. And they identified a few of these places where people tend to live to be 100. And a lot of people live into their 90s. And so there's Okinawa, Japan, there's Ocaria, Greece, there's Sardinia, Italy, there's a place in Costa Rica called the Nicoya Peninsula, and there's Loma Linda, California. And Loma Linda, it's because of the Seventh-day Adventists. They all basically, as part of their religious beliefs, they have a very healthy lifestyle. So Dan Buettner, published in the National Geographic about the blue zones. And what do they all have in common? Well, most of their calories come from whole plants. They get a lot of physical activity, not necessarily exercise, but they get physical activity as part of their daily lives. They're going to visit their neighbors and they walk up and down the hills, or they're out in the fields working. And they have great social lives. They're very connected. So a lot of that is, kind of just going back 100 years, this is how people lived.
Right.
And
it's a great way to live. It makes you happy, and you feel good about, the way you feel and about yourself, and which is kind of cool that, so often it seems in medicine or healthcare, you're being asked to do stuff that you don't really like. You know what I mean? Right. And certainly taking medicine is not something anybody likes. Who likes to pop pills, and who likes to pay for that?
Right.
One of the things is in today's world, pharmacy, it's a third of all healthcare costs. So buying all those drugs is not free. It's not cheap. If an employer or an employee or anybody is sitting back saying, well, how do I do this?
Right.
What would you tell them? How does someone change their lifestyle?
Sure. Well, first thing, just going back to the pharmacies, think about where the marketing dollars are.
Right.
They have all the money. I mean, they're incredibly valuable companies that have a huge marketing budget, so they can get the word out, and they can make people like us who are advocating for, simple things seem kind of cute or quaint or simple. That's nice, but no one's going to do that. Let's give them the medications. Let's give them their Ozempic, whatever. But our message to the employers is, how are you going to make your employees happy and productive, and how are you going to cut costs? And I think you want to start with, from the employee's point of view, well, I want to be happy, and I want to enjoy my job.
Right.
Right. And I wouldn't mind if I could, keep the money that I'm getting in, I'm getting raises every year, but if I'm paying out more from my own point of view, I'm paying more for insurance every year, that I'm not getting to keep my raise anyway. It's going to somewhere else, to somebody else. Somehow we have to get that message across. And, I call myself the high-tech doctor with low-tech solutions. High-tech always seems like, well, that must be better, especially if it has the word laser in it, right?
You're right. Yeah, you're right.
I can get my arteries opened up with lasers. These people know what they're doing, right?
Yeah.
But you know what? I can get your arteries opened with broccoli and brown rice.
Right.
So it's a complicated question.
I remember when I took your class, broccoli was a common theme because you use it a lot to compare it to, say, cholesterol medicine.
Right.
And the cost of cholesterol medicine compared to broccoli. Share it, if you don't mind sharing with us that idea.
Yeah, I mean, I say broccoli kind of, it's sort of in jest because, not everybody loves broccoli. I happen to love broccoli. But any green vegetable is great. I mean, all the leafy greens are amazing. And all those things actually work better than these medications. Yeah. Right. And oftentimes very quickly.
Yeah. It's just a habit in a way, I found that just starting to eat more vegetables, more fruits, it just becomes a habit, and certainly for breakfast or lunch, now if I do find myself eating something other than that, I don't feel very good. And so it's now pretty much a habit. But, for employees and for everyone, how would you get started?
Well, so we have our own 15-day whole food plant-based jumpstart at Rochester Lifestyle Medicine Institute, which is, our organization. But any way that people can switch over to a plant-based diet is great. Right. And, there's different ways you can do that. You can do it on your own. I mean, I think it's one of the reasons that teaching nutrition, which is really important, is not taken as seriously because, first of all, I make my living as a radiologist. Right. There's, I can make a nice income that way. It's pretty steady, and so there's really very little way to make a living in medicine, teaching people how to be healthy. Right. But where was I going with that? So
to get started, you could go to your institute.
You could,
or you just basically open up a book and say, this is how you eat a plant-based diet, I guess.
Right. Exactly. The thing is, you can't take out your own appendix. Right. So you need a surgeon for that, and you're willing to pay the surgeon for that. Yeah. People think, well, I can figure out this diet on my own. Right. But truthfully, a lot of people need help with it. So we provide all kinds of support. We do this every month in cohorts of anywhere between 30 and 100 people. If we have a big cohort, we break into Zoom rooms. Right. So that's our approach. That's what we have to offer to people.
Sort of like an immersion into the idea right away.
Yeah, and so there's this whole thing about whether you should do it all at once or whether you should do it gradually. We take the approach to do it all at once. Right. You're a grown-up. You can do anything for 2 weeks. Right. Because a lot of people need to be convinced, well, I don't think this is going to even work. But you're not going to know unless you go all in. Right. And you had an experience with your blood pressure, right?
Right. Yeah, I mean, my blood back in April spiked and was not happy or pleasant place to be with very high blood pressure. And so a friend of mine in the gym said, hey, you ought to look into the Rochester Lifestyle Medicine group and see if that has an impact, because
Right.
it wasn't going down, and
Mm-hmm.
the medicine that they wanted to give me and initially did give me wasn't having an impact. So so that's I went into it and
Yeah.
just did an immersion. And hey, for a guy who has eaten a lot of hamburgers, steaks, and pizzas over his life, I was a little skeptical, but it worked. It worked, and as I said, I now this past weekend had the lowest blood pressure reading I've ever had in my life, I think. Not that I've been focusing on it my whole life, but
Yeah.
yeah, but certainly in a long time. The other thing that I remember that jumped out at me that I think was just really compelling was how affordable this approach to eating was. You guys are very detailed, and like you give a list, a grocery shopping list,
Right.
for those 2 weeks, and you
Right.
can go to the grocery store and you buy this fruits and vegetables and that kind of thing. And it was very, very reasonable. I think like a full week was a couple $100.
Right.
And you contrast that with going to the grocery store and buying the stuff that's killing you,
Right.
and it's a multiple of that. And so that's one of the things that I think folks really need to understand is like, not only is this going to make you feel better long term and save a tremendous amount of healthcare costs for you long term, but in the short term, it's going to be less expensive to feed yourself. And you know, that's a win-win.
Yeah.
You know, in my book, that really surprised me at how affordable. In fact, I was really questioning whether it was real when I saw that number at the bottom of the list and it said this should cost you $200. I'm like, I went to the grocery store myself just to test
Okay.
it. And,
Okay.
And that's what it was.
Yeah.
So it's pretty cool.
Yeah.
Pretty cool.
I mean, I love the fact that you came into our program without it was sort of a stealth move on your part. Like, we didn't know that you ran an insurance company.
Yeah. I didn't. Well, I wasn't there. I didn't make the connection. I just was a guy who was feeling lousy with high blood pressure, and a friend said this can help you. So then I started thinking about it, and I'm like, boy, all of our employer clients, and certainly all of their employees, as you said, there's this side door.
Right.
You know, they're spending so much money on the healthcare system, and all they need to do is have a different lifestyle of food and activity and relationships. Boy, that's a message we really should let folks know. We give them all kinds of other messages. I
Sure.
mean, we give them messages how to buy those drugs more efficiently and
Right.
more cost effectively. We give them messages at how to find the most highest quality doctors. And those are all good messages. I'm not saying that's bad, but what I am saying, we should at least at the same time saying you can avoid all this.
Right.
You know, how
Yeah.
cool would that be?
Yeah.
You know, let's talk a little bit about company wellness programs.
Sure.
You know, as you know, you walked in our building. We have a gym.
Yeah.
We have a a lunch program where we bring in food that we think is healthier than maybe they'll get down the street. Why do you think they're not as effective as they need to be? Company wellness
Yeah.
programs.
So that's a great question, and I don't consider myself to be an expert on company wellness programs. You know, we offer our 15-day whole food plant-based jumpstart, which is really about nutrition. But I do think actually focusing on nutrition is critical, and here's why. Of all the pillars that I told you about, none of those are controversial. Everybody agrees we need more sleep. We should avoid tobacco and alcohol. We should cultivate relationships. We need to manage our stress. You know, all those things. Nobody argues about those, but they do argue about diet. Should it be low fat? Should it be high fat? Should it be keto? Should it be Atkins? Right? Or should it be what we teach, which is a low-fat, whole food, plant-based diet? And so, you know, my understanding about gym culture, and I don't say I go to the gym very often, but I mean, I do go to the gym, but not that kind of gym. But apparently there's this whole thing about bro science. Have you heard that term?
No.
And the idea is you got to be eating a lot of meat.
Oh,
right.
Yeah, the protein idea, right?
All this protein, but protein is such a myth. Okay. It's basically, if you're eating a whole food plant-based diet, you're going to get enough protein, more than enough. It's when people add junk to it. So they come up to me, you know, somebody comes up to me and says, "Oh, you're on a plant-based diet. Where do you get your protein?" And they're standing there with a bag of potato chips and a can of Coke. And I'm looking at, okay, the Coke, that's right, how many calories in that? You know, 120 calories. So like 5% of your daily calories right there. No protein, zero. Potato chips. Now, if you take white potatoes, they're 10% calories from protein. Okay, that's pretty much what you need on average from food. You add oil, and now they're 5% calories from protein. Okay, so that's why we find food so interesting and so important, because that's the place where people get into arguments and really don't agree. And I shouldn't say they don't agree. The people who know this, people in medicine who know the science, we pretty much all agree.
Right.
It's really very little controversy in the medical world, and the people who actually are paying attention. But that's not who's getting the attention out there. And
they think. I mean, you're spot on. Everyone thinks there's a protein issue if you go with a plant-based diet. They feel that somehow you're going to harm yourself. I mean, you have to give credit to the meat industry, because they have everyone convinced if you don't have a sirloin once a week, you're short of protein.
Yeah.
But that is just not the case.
The protein deficiency ward at the hospital is pretty empty. I haven't seen anybody there. Yeah, they're lonely.
What's that percentage of broccoli? I keep coming back to broccoli. If you don't like broccoli, sorry. But anyway, isn't it like 40% of broccoli protein or something?
Yeah, exactly.
Yeah.
So we play this game, and I'm glad you remember that. It's good.
Yeah.
You were a good student. So what percentage of your calories need to come from protein to avoid protein deficiency? It's about 10%. It's probably less.
Yeah.
Probably 7-8%. But let's, for the sake of argument, we'll say 10, maybe even 12%. So then, if all the food that you're eating during the day is at least that percentage of calories from protein, you don't even have to worry about it. All these people counting grams of protein, oh my God.
Yeah.
It's insane. But so white potato is 10% calories from protein, right? Which is what I just said is all you really need.
Right.
Broccoli is 44% calories from protein. Now, you need to eat a lot of broccoli to get enough calories, because it's not a calorie-dense food.
Right.
But that's great. Most Americans don't need more calorie-dense foods, right? Leafy greens, 30% calories from protein.
Wow.
Beans, in the 25% range of calories from protein. Whole grains, around 14 or 15% calories from protein.
Yeah.
So if all you ate were those things, you would get all the protein you needed without even counting grams.
So it seems like, my takeaway is, if you have a wellness program, you better have a heavy dose of this nutrition education.
Right.
And if you don't, you're missing out. Because, one time, you're never going to outwork your diet.
Right.
Meaning you're never going to be able to go into a gym and somehow burn through all the lousy food you've consumed. So that nutrition's got to be a part of any company wellness program. I think that's the message. Yeah. Let's talk about success stories.
Sure.
I mean, you have a full-time job, so the question is why are you doing this? You work all day as a radiologist, and then you run this organization here, and I'm sure you love to work at nights and deal with knuckleheads like me that are trying to figure out how to eat better. But my hunch is you have some success stories that really you feel good about what you're doing.
Yeah, and there's really nothing as exciting in the life of a physician as having somebody have an incredible success story. So, back before the pandemic, when we were just locally in Rochester, and by the way, the pandemic is why we're international now.
Right.
We do everything on Zoom. Before that, we weren't. But now we've reached people in 12 countries, all 50 states, most of the Canadian provinces.
Right.
Because we can do that. And that's one of the silver linings of the pandemic. But I still remember a woman who came in, and back when we were doing it in our office, and we had 24 people at a time in these cohorts, 24 to 30 people at a time, coming in every month, and we had finger stick machines, so we could do point of care lab testing. So we did finger sticks on day 1 and day 15. So this woman comes in, she's in about middle 50s, or chronic kidney disease actually, CKD, total cholesterol of 299. Wow. On day 1. On day 15, her total cholesterol was 149.
Wow.
Dropped 150 points in 2 weeks.
That's got to help the kidney, I imagine.
It helps the kidneys. It helps everything. It helps us feel like, wow, I guess this actually works. Because that was early on in our experience.
Yeah.
We're thinking, I've read about this, but do we really know if it's going to work? And yes, it does work. And it's amazing how much the human body wants to heal. So another example, a retired school teacher from Rochester comes in, he's just been diagnosed with diabetes. Hemoglobin A1C of 13.6. So if you know what that means, so hemoglobin A1C is your average blood sugar over the last 3 months. His average blood sugar was 350. Okay, but he didn't know that. You don't necessarily feel bad when that's happening. His doctors say, "Oh, that's not good. We need to get you under control." They ordered all these medications. He came to our office and said, "I don't want to take these medications. What do you think?" I said, give it a try.
Right.
So hemoglobin A1C of 13.6 on day one around Labor Day. By Christmas, and 3 months later in December, hemoglobin A1C of 6.0. And now it's 5.4. His diabetes is in remission.
Wow.
He never went on the medication. He never ended up going down that tunnel. He just took the exit door.
You know, as a health insurance guy, I hear those stories, and I think, you know, chronic kidney disease is very, very expensive.
Right.
You know, transplants and even like dialysis, those are some of the biggest checks we write.
Right.
And the idea that you could move away from that by changing your lifestyle and focusing on a plant-based diet, I mean, that's just fantastic. You know, and as you said, you're avoiding a lot of suffering. I mean, dialysis is not a fun time for anybody. So
yeah, I joke that we subsidize the insurance companies because that guy is not going to go on dialysis.
Yeah.
But no one's ever going to know that right. He would have.
Yeah.
So, but we saved a lot of money there.
Yeah. Well, this matches up so well with our model where when folks do those kind of things, the insurance, you're not subsidizing the insurance company. In our model, you're subsidizing the employee and the employer. Because our you know, I think, as you know, our approach is, hey, if you do these things to manage your health better, why should the insurance company profit from that? Right. I mean, the incentive should be that you, the employee, and their family members and the employer, they should benefit from these ideas. And that's in part why I'm talking to you, is to kind of get that work. Let's talk about scaling and tipping point. And so you have this organization. I think in my group of people there was, I don't know, 15, 20. If an employer, what would happen if all of a sudden your phone starts ringing off the hook and you've got 1,000 people? I mean, are people or employers able to introduce this to their employees?
Yeah. So first of all, let me just say I love what you guys do. And we've been talking about this for years at the American College of Lifestyle Medicine. We need to work with organizations that are self-insured because they're the ones who have the financial incentive.
Right.
Excuse me. As far as our being scalable, we are totally scalable. We use Zoom. We have a learning management system, which is, you know, pretty much underutilized right now.
Right.
But we also have a lot of facilitators and lifestyle medicine physicians in the background ready to go. So, you know, I've been thinking big about this ever since 2015 when we started. We had a different program that we taught, but I said, well, you know, what if we started to reach 100,000 people? That's how many people in the Rochester, New York area have diabetes, because it's about 1 million in that area.
Wow.
You know, 10% have diabetes. How would we manage that? So we've got, so we consider our Jumpstart to be medically facilitated. It used to actually be medically supervised when we did it in our office. Everybody who did the Jumpstart for the first 2 years, because we started in 2018, for the first 2 years, it was actually medically supervised. And then the pandemic came along, and March 2020 was the last time we brought anybody into our office. So we switched over to Zoom. We switched to a learning management system. And we've got, you know, I would say a dozen medical, you know, facilitators ready to go, probably 5 or 6 doctors ready to go. So yeah, if we were to, we could easily scale up to a few hundred a month at this point. Right. And if we got notice, there are we could scale up certainly within 6 months to 12 months. There's so many doctors out there who want to work with us, but we just don't have the demand.
You wonder what the tipping point's going to be. You have a great slide you show of the percentage of diabetes as it kind of grows over time in the United States, and like where it was, you know, 100 years ago, where it was. And it's like, at what point people are going to wake up and essentially say, I've got to change my lifestyle, and I got to change what I'm consuming. You have any thoughts on what's going to cause that to happen?
Well, our approach is to basically convince physicians that this is the way to go. We basically, because I think they're still relatively trusted. And I talked about marching into the belly of the beast, which is the current healthcare system, which, by the way, people have said is not about health. It's not about care, and it's not really a system. But anyway, you know, but the tipping point, it's going to be grassroots. It's not going to come from the top down. It's going to come from the bottom up, where people recognize this. And we see it in physicians. There's a switch that flips, and they suddenly get it. Yeah. And all of a sudden, you know, it often has to do with them changing their own lifestyle and going into a whole food plant-based diet and saying, wow, my blood pressure just plummeted. You know, my cholesterol is now normal. It's under 150 total. And I'm feeling good. Right.
You know, it's interesting, of all the times I've been in the doctor's office, they've never talked to me about, plant-based or lifestyle. I think that has to start happening.
It does.
I mean, I've cholesterol has been an issue in my family, so I've, been in those rooms talking about these issues, and it never comes up. It always comes up about something about, well, I'll put you on a statin or something. And now we've got these drugs like Ozempic and stuff. Right. It's, unfortunately our society is very short term, and it seems like a great idea. I'll just pop a pill and then I can eat whatever the heck I want. Yeah. And we got to get away from that. I mean, the outcomes, I think, I don't know. I've never talked to anybody about taking Ozempic on how they feel. I can tell them about how they feel when they go on a plant-based diet, and you feel pretty darn good.
Yeah, well, so I appreciate that.
Yeah, got to get that message out. The other thing I want to give kudos to you on, and I love to read and I love to learn. Right. Your learning management system is just amazing. All the information you have, all the studies, and then as we learned as we walked in the office this morning, I got in a little trouble from my wife, Molly, and my daughter, because when I was in your program, they were cooking the dinners, and I didn't give them kudos during our call but they cooked the dinners from the recipes that you posted, and they were fantastic. And that learning management system, so if anybody's ever concerned, there's no way I can eat a plant-based diet, I won't know what to eat. There's so much information in there, but I did get a lot of help, I have to confess.
Help from your wife and daughter?
My wife and daughter helped cook the meals in the evening. So I was on my own for breakfast and lunch and snacks, but the dinners were all on them. So, cool. But I do that learning, that resource is fabulous.
Oh, thank you.
Anything you want to chat about that I haven't asked you about?
Well, actually, you were talking about what's going to make things change. Are you familiar with shared medical appointments, SMAs?
No.
Okay.
No. Yeah.
So, because you were talking about how your doctor doesn't talk to you about diet or lifestyle, because it's a longer conversation. Right. Right. I mean, it's one of the ways that we work with doctors, and especially in the lifestyle medicine world, is they'll see the patient first for an hour. Right? Have a nice long conversation, but then they'll send them to us for more training, because we have 10 hours of live, Zoom, right? Plus 24 hours, 24/7 to go to the learning management system, and there's things released every day, and then the doctors will see them for an hour afterwards. So it's before, during, we provide the education, and then the doctor sees them again afterwards. And we actually work with a number of lifestyle medicine doctors in that using that model. But the shared medical appointment is for doctors who want to spend more time with their patients, but they can't afford it, because the way the payment system works, they don't get paid enough to see somebody for an hour. But you can bring somebody in, so you can bring 5 or 10 patients into your office at a time. Oh, wow. And you can charge the same CPT code. I got you. For all of them. Yeah. So now, instead of getting their $100 or whatever they're getting for their particular CPT code, now they're getting $1,000. Yeah. Right? If they have 10 people, which is pretty hard to do. Perfectly honest. I mean, SMAs, the shared medical appointments, are great in theory, but actually getting all these patients in your office at the same time are pretty challenging. Right. That's what we've seen.
But digital medicine allows that.
Yeah.
Zoom allows that.
Yeah. So, I mean, as an insurance company, I think that's really important for you to recognize that that's something you might want to,
encourage that. Yeah. Yeah. It's related to, we're big fans of what's called direct primary care. Right. Where essentially, instead of this, fee for service, CPT code every visit type of approach, is reimburse or change the payment system for the doctor so that they can spend some time with a patient. Right. That they know, hey, I'm getting this much money every month for this patient, and I can't afford to spend an hour with them so that kind of payment approach we're big fans of. Really? And we actually we work with a bunch of, we call them DPC, direct primary care, but one's called Hint Health, and our customers have access to Hint Health. Okay. So if they want to get away from the primary care based on a fee for service, and they want to go with this direct, where they get, hey, I pay a fee every month, and I can go see that doc as much as I want, and I can talk to him as long as I want, and we're big fans. It's a better, because the bottom line is, just like lifestyle medicine is not reactive, it's preventative. Right. Well, primary care is another the same idea. Like, why wait until you have to go to an emergency room because something is really, really a problem? Go see your primary care doc. So we're big fans. Like, one of the things we incent our own employees to see a primary care doc at least once a year.
Right.
I don't know if you're familiar with this statistic, but something like only 40% of the American worker has a primary care relationship.
Oh, did not know that.
Yeah, and I mean, so that's a problem. That's not good.
Yeah, yeah.
So what we say is everybody should have a primary care, and then if we could layer on top of that primary care doc teaching them about lifestyle medicine and plant-based thing, then we're starting to get preventative and not reactive,
Right.
and that's really what.
Right.
Let's get away from this sick care.
Yeah.
Yeah.
Just lifestyle medicine can be reactive in a good way.
Right.
That's how we demonstrate our value. When
Okay.
somebody comes in who's got diabetes and they're really sick,
Right.
and we help get them better.
Right.
You
Or
know-
a guy like me with blood pressure. Get that fixed. Yeah.
Because truthfully, we don't really get people's attention
Yeah.
by keeping them healthy all along, because they never show up on the radar,
Yeah, yeah.
right? Whereas if you can reverse somebody with
Yeah.
angina,
Yeah.
heart disease that's clinical, and it goes away on a plant-based diet,
Yeah.
which we can talk about also if you'd like
That's
to.
a success story
That's
too.
a success story, and
Yeah.
that's something where you can actually demonstrate. Well, there's the value. There's
You wonder how many people that are in the coronary care are moving to plant-based diets, because it seems like because when you're in that place, you'll do anything to try to start feeling better.
Right. So, Dean Ornish kind of got this started back in the late 80s. He did the first randomized controlled trial demonstrating that you could actually reverse heart disease and objectively show with angiograms on day one and then 1 year later that the arteries actually open up.
Wow.
But more importantly, the symptoms will go away, which is really, most important. And then Dr. Esselstyn from the Cleveland Clinic, he came along, kind of reproduced that, and that's what we model our 15-day whole food plant-based jumpstart on.
Right.
But there was something I just wanted to say. What was it? It was about what you had just said.
Well, reactive versus preventative.
Yeah. So, I know. So we're always asked to show, well, what's the ROI? What's the return on investment on on the lifestyle medicine or plant-based nutrition? Nobody ever asks, what's the ROI on a coronary artery bypass?
Right.
Right?
Yeah.
They don't get asked
That's a great point. Yeah. Yeah. What is the ROI on saving my life? Because I'm not gonna.
Right.
Yeah.
Or what's the ROI on dialysis?
Yeah.
Our ROI really is that talking about reactive. We can prove our value by keeping somebody off of dialysis and saying, well, that's how much money you would have spent.
Right. Yeah. Yeah, it's great. Well, the ROI is a happy person. I mean, someone who's experiencing angina or chest pain and changes the way they go about their daily lives, and now they don't have that. That's a happy person. So that's a great thing. So, well, good. I've enjoyed the conversation. I know we could probably keep talking here forever.
Sure.
But the big point I think we need to know is there is an opportunity to get away from sick care. There is plenty of opportunity to become a healthier person and have a lifestyle that is much more rewarding than maybe you're experiencing today. So thanks for the good work you do.
Absolutely.
And Roundstone is really pleased that we've made the connection.
Oh, great. Well, thank you so much for having me here.